Well, thank you so much for joining us today. We're here for the launch of the first Canadian textbook on public health nursing. It's such a monumental event, and this textbook is really timely, and I would say it's a call to action on many levels for us in public health nursing. So I'm Dr. Cheryl Cusack. I am a registered nurse, and I was really privileged to be involved with the book as an author and in crafting the book's forward. And today I've been invited to moderate this panel discussion. So to start with, I'd like to respectfully acknowledge the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene peoples, and the national homeland of the Red River Métis, where I'm joining from today. Before introducing the panel, I'd like to thank Canadian scholars for hosting today's webinar. We have a total of 40 minutes for the panel presentation, and the last 10 or so minutes is open for audience participant questions. So feel free to add any comments or any questions that you have in the Q&A button. And as Emma said, today for joining us, Canadian Scholars is providing a 20% discount code that's available to all attendees. And you can also get that at canadianscholars.com until the end of November. And they're also giving away 3 copies of the book. So 3 lucky participants will be able to check their email and see if they were fortunate to get those textbooks. So today we're joined by 4 esteemed panelists, Ruth Schofield, Karen Beckermann, Dr. Shannon Vandenberg, and Dr. Erin Courtney. Before each panelist introduce themselves, I'd also like to acknowledge Danielle Bork-Bearskin, who unfortunately was not able to be with us today, but was a really valuable participant to the book. So Danielle Bork-Bearskin is a proud First Nation woman and member of the Beaver Lake Cree Nation in Treaty 6 territory. She's a registered nurse and community health leader whose work centers on Indigenous health equity, cultural transformation, and self-determination in health systems. I'd like to invite the panelists now to introduce themselves. So we'll start with Ruth.
Hi, it's Ruth Schofield, and I am thrilled to be joining you today. And I'm joining you from Mohawk Nation, which is one of the nations making up the 6 nations on the Grand River territory. And yeah, I'm one of the co-editors of this wonderful book. So do you want me to carry on at this point, Cheryl, or just introduce ourselves?
Sorry, I was sorting out my dogs. We'll invite Karen to go next.
Hi, my name is Karen Beckermann. I'm a nurse living and working at Toronto Public Health in Toronto. So welcome everybody. And I am not an academic. I am a practitioner in local public health. Thank you.
Karen and Shannon.
All right, sorry, I was just trying to find my unmute button here. Hello, everyone. My name is Shannon Vandenberg. I'm a registered nurse, public health nurse, and currently the Assistant Dean of Nursing and a nurse educator in the Faculty of Health Sciences at the University of Lethbridge in Alberta, Canada. And I reside on Treaty 7 territory. And my background in public health nursing really allows me to bring these public health issues such as climate change, infectious disease spread, and communicable disease control into the course I teach. Really hoping that this helps students gain a practical understanding of the relevant health issues in Canada and around the globe. My program of research is in planetary health issues such as climate change and climate-driven vector-borne diseases. My work has been published in several journals, and I've also co-authored several textbook chapters on planetary health, communicable diseases, and climate-related issues. So really happy to be here today.
Sure, Shannon. And now Erin.
Well, good afternoon, everyone. Thank you for joining us. I am Dr. Erin Courtney, and I'm a professor and the coordinator of the BSCN program at Lambton College in Sarnia. And I am an assistant professor at Western University in the Doctor of Education, Educational Leadership program. I come from 20 years in public health. I spent about 13 in Healthy Babies, Healthy Children, and approximately 8 years as a supervisor for infectious diseases prevention and control. I'm the co-editor of the textbook with Ruth. I really like to say I am, you can take the girl out of public health, but you can't take the public health out of the girl. Yeah.
So true, isn't it?
So true.
Thanks for all those great bios. As we all know, public health nurses are integral to advocating for, supporting, and maintaining the health of populations. The textbook really teaches nurses how to engage in upstream thinking from a community and population health perspective in order to address clients on the individual, family, group, community, population, and systems level. And it's a comprehensive approach that includes communication, policy planning, implementation, and evaluation, in addition to policy standards and ethics. So now I'm going to invite each panelist to share their thoughts and insights. So we'll start with Ruth.
Thanks, Cheryl. I didn't really give myself a bio so I need to build on that a little bit more. So my background is public health, as you can anticipate, many years in public health in various programs, and then went into academia. So I'm retired faculty from McMaster University in Hamilton, and now continuing it at Mohawk College at this point. But my experience in public health, it certainly has been part of my career. And so I'm really want to acknowledge just the work that public health nurses do in particular that has informed this book. So it's an incredible day. Today we're celebrating something that's truly historical, the launch of Canada's first public health nursing textbook. Yes, the very first. It's been a long time coming, and Erin and I couldn't be more thrilled to share this moment with all of you. I'm truly honored to be to have a co-editing role with this book with Erin. Although we've only known each other for a short period of time, been in public health for years, both of us, we quickly discovered our shared passion for public health nursing and dove headfirst into this incredible project. Collaborating with more than 45 outstanding public health nurses grounded in practice, academia, and even we had a medical officer of health. And these nurses were from across Canada. And this has been an unforgettable experience. We are fortunate to have so many nurses with extensive practice expertise eager to contribute their knowledge, practice, and enthusiasm in each chapter. Indigenous public health nurses wrote in several chapters and reviewed the whole book, as Cheryl alluded to, and we'll be hearing more about that, as she mentioned. And with the inclusion of a medical officer of health, that was very interesting for a couple of chapters that really kind of brought an interdisciplinary perspective into our work as public health nurses. So what started as a dream 2 years ago has now become a reality. And today, that reality is in your hand. When we first conceptualized this book, we asked ourselves, what do readers need to understand about public health nursing in Canada? The answer was clear. They needed to start at the very foundation. So we begin the book in the first section and dive into the essence of public health, its function, its structure, legislation, and policy. We explore Indigenous public health, something we'll hear, as I mentioned, more about. The history and the future of public health nursing. The foundations of public health nursing are illustrated through the application of the community health nursing professional practice model and the core knowledge that grounds nursing practice, theories, ethics, evidence to inform practice, and leadership. From there, we go into the next section, which really expands on the science of nursing to bring in and really show a public health nursing lens. The authors bring alive the new science related to planetary health that Shannon alluded to, and we'll hear more, and built on the essential public health science of epidemiology. Critical areas for public health nursing nurses who are shaping the health in a rapidly changing world. As well, foundational public health sciences relevant for nursing practice are examined, like population health, community health, health equity, and structural and social determinants of health. The third section moves into how nurses do this. What are their approaches that they use every day, such as health promotion, disease prevention, and how they integrate cultural diversity, inclusion, health equity, trauma, and violence-informed practice grounded in theoretical or practice models like Ottawa Charter, population health model, and the 5 levels of prevention. These aren't just concepts. They're the nursing practice realities faced in communities across Canada. Then in the fourth section, we explore how public health nurses think. How do they work with individuals, families, communities, and entire populations through assessment, program planning, implementation, evaluation? These are all the building blocks of effective public health nursing practice. Then in section 5, we focus on communication in public health nursing because collaboration doesn't happen by accident. It requires purpose and strategy using a population health framework, which is new in nursing, is not part of what nursing practice is, but integral to public health nursing. The whole use of AI and machine learning will be examined in the chapters. Then in the last section, 6, brings it all together with the programs and services that define public health in Canada. The public health nursing authors articulated the roles of public health nurses in the programs and services related to child health, school health, healthy communities, environmental health, infectious and communicable diseases, mental health and substance use, and emergency management. These are the areas where theory meets action. Readers will resonate with the authentic practice of what and how public health nurses promote the health of Canadians. And that's not all. We've included 5 appendices packed with resources, the community health nursing standards of practice, which are currently being updated, but we have the 2019 version in there. The 2025 public health competencies, core competencies. We also have the 2009 public health nursing discipline specific competencies. They're likewise being modernized now. Our next book will have them. And the entry to practice public health competencies for undergraduate nurses likewise being updated. And so they will be in as well. And a list of selected infectious and communicable diseases. And lastly, there is a comprehensive glossary. But here's what makes the book different. It's not just information on a page. We've brought the content to life with authentic practice stories in every chapter. Critical thinking questions, research highlights, visuals, graphs, charts, and images. Plus, we've created online faculty resources, learning activities, recommended readings, NCLEX question, PowerPoint presentations, infographics to support both curriculum and professional development. This book is more than a resource. It is a tool, picking up on Cheryl's point, to advance and strengthen public health nursing across Canada and to prepare our future public health nursing workforce. And today we're very fortunate to have some of our chapter authors, as was mentioned, to join us to share their insights and messages from their experience as chapter authors. So as we celebrate this milestone, we invite you to think about how this book can support your current and future practice in public health nursing, your nursing curriculum, and ultimately the health of Canadians. Together, we can make public health nursing stronger than ever.
Thank you so much, Ruth, for that great overview. And I was so excited to get my book, and just want to say the way it's been organized makes so much sense and is so logical. Courtney, do you have a question or was that an accident with your
That was an
hand?
act. I was trying to throw up the
Oh, the
hearts,
applause. Right. Okay. Yeah.
and the applause.
Okay.
And yeah, anyway.
Okay. Great. Karen, we'll invite you to share your comments and thoughts next.
Hi, everybody. I imagine it's morning for some of you, afternoon for some of you, but welcome. Thank you for taking time. I didn't do a full bio. It's not extensive from an academic perspective, other than to say I'm a nurse. I went into nursing specifically to do public health nursing. And as life happens, took me 10 years to land in public health nursing. I worked in inpatient psychiatry, internal medicine. I worked in Germany, in Morocco. I've seen nursing. I've seen practice in different countries. I've done some research, but it was truly being in public health that I love. My career in public health has been quite diverse. I am a practitioner. The theory guides me. I will say a couple of things. So just full disclosure, the picture in the background is my high school in Niagara Falls, and it happens to overlook the falls. So I think it's different and a bit of a, however, it also has a residential school look. So that is something about when things were built, etc. But that is, in fact, my high school. There's a couple things I'd like to say about this book. That's both, I mean, from an academic perspective, we find in local public health, people enter often, they actually don't know what public health is. If anything, following the pandemic, they might think it's case investigation and vaccination. It's so much more than that. It's really about the health of the population. Our partners are not healthcare, they're communities, they're school boards, they're parks and recreation, they're social services.
Mhm.
Our work is to, improve the health of the entire population, to really address inequities where we work, and to prepare for and respond to public health emergencies. So I had the privilege of writing, co-authoring the chapter on Ruth referred to as emergency management. I would say emergency preparedness, because really our role in public health and including nursing is making sure we are prepared to respond to emergencies. We had some discussion writing the book, if that should be at the beginning or the end. Actually, being prepared for an emergency is not an afterthought. It often gets put at the end of our work because there's always something else to deal with. But as we saw from COVID, if you don't plan for, you cannot respond to an emergency. In a local public health practice, this, we can see this as useful for students to learn about what, in fact, is public health, the breadth that it is, as well as it's a really good resource for people nurses working in public health, wherever they sit around the country. To a refresher, it makes a good orientation so that it comes alive when you're doing it. In our section, we're really cognizant of there are two types of emergencies that public health could be involved in being prepared for and responding to. So some are public health emergencies, and for those, we generally think infectious diseases and outbreaks and, epidemics, pandemics. I mean, what we experienced in COVID was certainly something we never expected to experience. We always think about flu, but in reality, it's about doing what we do, just a whole lot more of it. And sometimes that more of it is a lot more. So those are some of, that's an obvious one. What's less recognized is all the emergencies for which public health has a role, but we're not the lead agency. It's not our lead, but the implications are quite, from an overall public health perspective. So if you think about a train derailment or a leakage of, or contaminated water, public health is involved in making sure people are safe, testing water, when is it clear to return to an area from a public health perspective, and then that ongoing monitoring on the health of the overall population. It's often important to remember that in public health, our results are rarely instantaneous. We don't see them, but if we look over the years at some of the health interventions that have really made a difference in the population, think things like clean water, vaccines, those are public health interventions and have dramatically improved the health of the population. The way I like to think about it is, so there are 6 of us on the panel. If this was pre-clean water and vaccines, 3 of us wouldn't be here today. We probably wouldn't have made it to grade school if we were so lucky. So it just puts things in perspective on the interventions and things we take for granted. So we want to respond to the emergencies, but from a health preparedness, emergency preparedness and management, public health has to be there, and nursing has to be there. Not always thinking about the client at the client level, but the work we do in partnership building and capacity building is what makes the impact when the emergency comes, because it's going to come. You cannot plan to the emergency, because the one thing is it's not going to be like the last one.
Thanks so much, Karen. That definitely puts public health nursing into perspective for us, and thinking about 3 of us not being here certainly does. I'm going to share Danielle Bork-Bearskin's contributions next. So Danielle wrote she was honored to be co-author of the chapter titled Indigenous Public Health Transformation, alongside her mother and mentor, Dr. Mona Lisa Bork-Bearskin, nursing colleagues Sonia Jakubek and Vicki Loader, and she extends her heartfelt gratitude to the editors and Canadian Scholars team for creating space for Indigenous voices within this text. The title, Indigenous Public Health Transformation, was chosen intentionally. The authors wanted to move beyond the idea of systems to emphasize transformation, a word that speaks to growth, resurgence, and collective healing. The chapter provides an overview of the genesis, legacy, rights, and context of Indigenous peoples, public health in Canada, grounding readers in the truths of colonialism and its ongoing impact. It invites public health nurses to move past deficit-based narratives and engage in rights and strength-based approaches that uphold Indigenous self-determination and well-being. Transformation reflects not just reforming systems, but reshaping relationships, structures, and moving collectively forward. This chapter, and really the entire text, feels like something that's been a long time coming. We've needed to open up these spaces in nursing for many years, and even if it's just a small crack, it's an opening for other Indigenous scholars, nurses, and community voices to step forward and share the history and lived experiences of Indigenous health and transformation. The authors hope readers and educators alike will use this book not only as a resource, but as a guide and one that challenges us to think critically about public health, to practice with humility and relational accountability, and to practice public health in ways that honor Indigenous knowledge and leadership. Wow, it's so sad that Danielle wasn't able to join us, but really glad that she included this for us to share. So Shannon, would you like to go next?
Sure. And I loved how Karen and Erin talked about their beginnings as a public health nurse. I'm, I feel like I'm still relatively young, but getting older, I start to think, I see that when I see my students, I feel really old. But anyway, when I graduated nursing school, I went in to become a public health nurse. And at the time, all of my peers and friends said, why are you going to public health? That's not really where the action is. And so when I was asked to be part of this book, I think it just really, I'm just really, really excited about this book for so many reasons, because I think for students who maybe don't know very much about public health, or, maybe they're intrigued, but, this book will just really, I think it will really do a really great job of instilling the same passion for public health nursing that I had when I graduated. And, we didn't have a book like this. And so I think this is just so exciting in today's day and age, where students have the opportunity to really see, and I think it was you, Karen, who said you really see public health coming alive in this textbook. So I think this textbook launch is exciting for many, many reasons. Many of which I've just spoken about. My specific role in this book was really around some of the chapters around planetary health and infectious and communicable diseases. And I really wanted to highlight that I think the really exciting piece in this book is that we have integrated the concept of planetary health, which reflects the evolving role of nurses in understanding and addressing the interconnections between human health, environmental systems, and global sustainability. And while planetary health is not a new concept, the term has only recently gained traction in nursing literature. So I think it's just really, really exciting that the integration of this concept throughout the textbook makes it a particularly strong and forward-thinking resource for nursing education, as well as for practicing public health nurses. When we look at the calls to action on the in the national arena about integrating planetary health within nursing, when we actually have it in a textbook, it really makes the case that we need to be integrating this within nursing curricula across Canada. And so having not only one, but two chapters dedicated to planetary and environmental health, I think is really, really exciting. Another really important piece that I would like to highlight is that the textbook recognizes Indigenous perspectives as foundational to planetary health, and these perspectives are thoughtfully integrated across multiple chapters, really providing a holistic and inclusive understanding of health and the environment. The textbook weaves planetary health principles into public health nursing roles and competencies. It emphasizes key areas such as climate change adaptation, disaster preparedness, as Karen was talking about, sustainable healthcare practices, and environmental and climate justice. Through evidence-informed frameworks, relevant case studies, and practice stories, students and practitioners are encouraged to critically analyze how planetary health influences health equity and population outcomes. And this integration really equips both future and current nurses in advancing both human and ecological well-being within diverse public health practice settings. Another exciting feature that Erin and I co-wrote is the chapter on infectious and communicable diseases. And Erin and I worked closely to really ensure that the diseases discussed in the chapter are timely, relevant, and rooted in the Canadian context. And as Ruth mentioned, there's also an in-depth appendix of the various diseases that we see on a regular basis in Canada, recognizing that emerging diseases are always a threat. And as Ruth mentioned, a subsequent version of the book, we may include new diseases that, again, when we're looking at the evolving nature of public health, we really need to be mindful of that. So that's something to look forward to as well. The case studies and practice stories in the textbook highlight various public health issues that public health nurses are dealing with in Canada today. In the planetary and environmental health chapters, practical case studies are included, which are relevant in the Canadian context, such as wildfires and pollution. And in the infectious and communicable disease chapters, readers are introduced to the public health nursing role in addressing public health issues such as E. coli or bacterial meningitis. From my perspective, both as a public health nurse and nurse educator, this textbook is relevant, practical, and easy to follow, a very valuable resource for both students and faculty. And I've advocated to my own nursing program that I feel that we need to change the textbook that we are using in our community health nursing courses and really to look at this book because it is so engaging, it's student friendly. And like I said at the beginning, I really think it instills a passion for public health and it has the capacity to do that. And so I'm just really, really excited about this book. So thank you.
Thank you so much, Shannon. And Erin.
Well, I can't be on Zoom and share a slideshow. So I'm just going to share. All right. All right, so I am lucky enough to have the pleasure of applying the textbook in practice and academia. So as an editor, of course, I read through this textbook multiple times over and over again. And each time I went through it, I just love public health more and more. It was an absolute labor of love and passion. And I'm lucky enough now that I get to still continuously read it again and again as I teach a public health course. So there's a little background. At Lambton College, we have a new standalone BSCN program with our first cohort that began in September 2023. The first cohort's now in third year of the program. When we were discussing the courses or layout of the program in 2021, 2022, adding public health to the curriculum was very important to us as we need our students to graduate, these registered nurses, to graduate knowing that there's more to nursing than acute care, starting an IV, inserting a catheter, and public health for sure was that piece. So in third year, term 5, so right now, we have a public health nursing course and it's worth 3 credits. And in term 6 or next semester, so the second semester of third year, we have a nursing research course specifically related to community and public health, and it's worth 4 credits. And I am now, of course, I'm the lucky one to be developing and teaching these courses. And of course, like I said, using the textbook. So starting with this semester, I'll talk about the public health nursing course specifically. So in this course, I've covered every chapter of the textbook. Of course, I started with the foundational chapters. So, the core concepts of public health, the functions, the structures, the theories that underpin public health and public health nursing. And then, of course, the sciences and then the approaches, and then getting into now, I'm currently teaching the programs and services that are related to public health and public health nursing. So when I did set up the course, I like to set up the courses around evaluative measures. And really, what are we looking for, right? The goal is that they absolutely understand, have a solid understanding of public health and public health nursing. So as you can see, here's my evaluative measures, two midterms and a final, which is pretty standard for our theory courses. But the fun assignments that I have is a photo voice assignment and then a public health campaign assignment. So all the public health or the photo voice assignment was based on the saying, public health saved your life today, and you probably didn't even know it. And so therefore I titled the assignment, Public Health Saved My Life Today. So in pairs, the students had to take a selfie of something that showed where public health saved their life. And then they presented it in a slideshow in week 6. And after we discussed public health communication. So it was a really nice linkage. And I waited till week 6 because they really needed to understand what concepts are involved with public health. So I asked the students if I could share a few of them with you. And so here's an example of injury prevention, helmet safety, concussion, education. And so this was, and then the students were able to talk about their picture, and then we were able to have a discussion on all of them and bring the concepts, apply the concepts. And then another one with seatbelts save lives. So injury prevention again and harm reduction. And this was a nice example to talk about public policy and how implementing public policy is really big for changing society and in order to, for good health outcomes. And then this is one where they incorporate a lot of different concepts around human health and food safety, hand washing, zoonotic diseases, infectious disease. So it was really fun to do. The students, they really enjoyed that assignment, and we did have a great conversations around their ideas. The public health campaign project is a group assignment. It's completed in 4 phases, and the planning and research, there's a planning and research section at the beginning. There's some strategy development, implementing and evaluating it, and then reflecting, of course, which is extremely important in nursing. So the students, they had to select a public health issue. They had to do some research around it and create a campaign and the campaign materials, and then they have to launch the campaign, which that campaign will be launched December 1st. So we're not there yet, but almost. And then they have to analyze its effectiveness. So that's phase 4 of the campaign, where they have to evaluate and then reflect on it, which is part of their final exam. So each phase has specific requirements and rubrics attached. And I structured the phases related around the content taught. So for example, week 3, we talk about evidence-informed decision-making, chapter 7. Week 4, program planning, which is chapter 17. And then in week 5, we talk about epidemiology, which is chapter 11. And so and then phase 1 was due after we've talked about those concepts. So we talk about, that research piece and analyzing the data to show that there is a public health issue that needs a campaign for it. I also incorporated 4 weeks with guest speakers, which was super fun and probably the highlight. So for example, I taught infectious diseases, so chapter 24, and it really worked well with epidemiology as well. And then I have a friend, which is a former staff nurse who works in infectious diseases at Lambton Public Health. And she came to my class and we ran a mock measles investigation, which was really fun, where we had the students, they had to read the lab reports, they had to look up case definition, determine whether the case was probable, suspect, and then we discussed the steps that were involved in the outbreak management of that, and including the communication, and what different communications would go out. It was super exciting. The students were so excited about it. They thought, it was really fun. So shout out to Jess Wood for that. Another guest speakers that I had were 2 students that went to Tanzania in April and to do their consolidation with the University of Windsor. And they talked about health teaching they did there and the work in the clinics they did and working in third world countries and in the health aspect. And they discussed, the trials and the turbulence they experienced, and they had a lot of pictures. And this was really around, of course, around the planetary health and environmental health. And so I had them speak, and then it was really nice to be able to apply the concepts that they talked about in the class to those two chapters. So one anecdotal outcome I can share that I've seen so far is really the shift in mindset of the students. For example, I found that in midterm one, the overall average was 71%. And I found that their answers, the students were kind of still stuck in the acute care model, individual care and how to make people better, right? Whereas now I'm seeing that instead of how do we make people better, the idea is shifting and okay, what are making these people sick in the first place? So look, really thinking about population health, policy, social justice, advocacy. So in midterm two, which we just had on Monday, the class average was 80%. And I can really see, based on statistics of the questions, that their understanding of, the 5 levels of prevention, and they can match those the concepts to the examples better. And the importance of, again, public policy and equity, social justice, and fold into the incorporate that public health perspective and population health. So looking at the next semester in the community and public health research course, I'm gonna use the textbook again, and really more of it is a review of some of the chapters, but then some of the chapters we really dig deep into, like planetary health and environmental health, even more specifically, such as the United Nations Sustainable Development Goals, or the SDGs, and how nurses can address the SDGs from a planetary health perspective through research. So again, these are, the class is structured around this planetary or environmental health research proposal, which again, I've phased approach where students develop an evidence-informed proposal using public health decision-making steps, right? Research design, a pest analysis, and needs assessment across these 4 phases. They have to define a planetary or environmental issue. They need to gather and appraise some evidence, select an appropriate research design, integrate these components into a final proposal. And then with it, in adjunct with that is an implementation plan and evaluation metrics and with a logic model. And again, using the textbook where we dig into those specific pieces, and so they can now apply them again. And then, of course, they present their proposal at the end. So really, there's only 6 weeks of teaching this content, and the rest is around supporting the students with their projects. So I'm still working on the course details, but I know at least they're going to come to the course with a solid understanding of public health nursing and the important roles that public health nurses play in our communities and in population health. And so overall, I'm super happy with the application of the textbook. And again, every chapter I'm teaching, my passion is emulating from me, I'm sure. And one of the students recently said, I really have to say, at least with this textbook, I can understand what I'm reading. And that really speaks to the stories that we have put into each of the chapters to help and contextualize what these concepts are and really make the public health nursing and public health practice real. So.
Thank you so much, Erin. I'm excited to learn more about your courses. That will be, I think, really helpful. We want to at U of M also look at some revisions. So I think that what you've done here is fantastic work. So we do have a few questions coming in, which is super exciting. So we've got about 15 minutes for questions and answers. Just to let people know, Canadian Scholars will be posting this webinar on their YouTube channel after the webinar is complete. So feel free to share for those who weren't able to join. I'm not sure if if we're the only ones who can see the Q&A. I know some of them have been answered, so I'm just going to read out some of the comments and questions that are here. We have a comment, this is so exciting. Is there comment dedicated to healthy built environments in the textbook? And excited to get my copy. So Ruth, you answered that, so maybe I'll let you answer that and speak to that a little bit.
Sure, I'd be pleased to. Yeah, we had a couple of authors who are very experienced in working with healthy communities. So it's really a community and population lens to public health nursing practice. And they go nicely into built environment. I mean, you can't help but do that. And they really bring forward a practice experience where they, as public health nurses, were involved with creating a healthy community at that level. And I think that's the piece that a lot of, particularly when you're new in public health or students, to conceptualize working with a community is very different than working with a person, one person. And so this chapter, along with almost the others, and I think Karen certainly alluded to that, and Shannon, when they're looking at from a practice perspective, how we work at a population level. So, yeah.
And while we're talking about different sections in the book, another person has asked about working conditions and advocacy, including nursing associations and union activity.
That's a good question. I think we bring it forward in, I know I believe I pulled it out in the foundations of public health nursing, that we are involved with associations in what we do. And I believe that also comes out in some of your stuff, Shannon, didn't it? When you were connecting them with Kane, and that I believe there was some connection in planetary health, just so that we know that nurses do work with other associations when, or public health nurses do when they're advancing the health of communities.
I talked about it. Oh, go ahead, Shannon. Go ahead.
Oh, go ahead, Erin.
Well, I talked about it. I brought advocacy in near the beginning when we're taught with the Ottawa Charter.
Yep.
And it's part of the Ottawa Charter. And so giving examples and having students talk about what kind of advocacy roles have we done, or, being in public health for so long, was able to share examples where, advocating for healthy foods in low-income areas and things like that. So bringing those case stories into the practice to show what are those elements of the Ottawa Charter and how we can apply them.
Mm-hmm. And we tried to do the same in our chapters as well, because I think sometimes when we're talking about large issues like planetary health or, sustainable development goals, it can be really hard for students to really grasp, what can I do, right? That's so broad. So trying to narrow that down, what could you do in practice, right? To provide some of those advocacy pieces there. What would that look like if you were a practicing public health nurse? What could you do? Who might you work with? Who are those organizations that you might advocate to or with? So trying to bring that across for both students and practicing nurses, that it doesn't feel like this really nebulous piece, right? When we talk about advocacy, often students, get a little overwhelmed because we talk about it. And I think I heard at one point, advocacy and leadership are the most overused words in nursing curriculum, but students really don't have an idea of what that looks like. And I think this book really does a nice job of applying that to actual practice settings.
Yeah, so it sounds like it's threaded throughout in many, many different chapters. Just building on the discussion that we're having, there's also a comment about creating a platform to continue the conversation around advancing nursing competencies for planetary health and emergency management. So just wondering if Karen or Shannon want to comment on that.
Oh, you're on mute.
Certainly, Shannon, please add to it. But I think there's emergency planning and preparedness. So a lot of that advocacy work and preparing a community to respond is, well, things we can do to prevent the emergencies is always your best bet. But then also all that engagement work with the capacity building and the partnerships, so that in an actual emergency, there's two things. It often starts with who you know, that really call a friend. And you're looking at if you have disorganized chaos at the beginning, you are doing extremely well. It means you're started and you build on it, but you have those relationships, you know what to do, and you're helping to bring people together. It's never fast enough. But if you think about working with schools, how to protect students and schools, knowing that education outcomes really contribute to people's long-term health, having that, you know, or planetary health and climate. We're all seeing more extreme weather, forest fires, being prepared when those happen, to have the pieces for people and safety, air quality monitoring, and thinking beyond the actual fire. So those are some examples I can think of.
Thank you, Karen.
I could just quickly add to that around the core competencies. Absolutely. I think this book does a really great job of advocating that these are not just specialty areas, as mentioned in the Q&A here, but it is something that all public health nurses need to know. And so there has been some of that push toward our regulatory bodies to include this as entry to practice competencies, with the Canadian Association of Schools of Nursing to include that as well as these core competencies. And then just the recently released position statement by the Canadian Nurses Association on planetary health, I think is a really positive move in the right direction as well.
Thank you. I think the next question is for Erin. Do you link the information and guidance with epidemiological methods?
Yes, absolutely. Epidemiology, I mean, it's so foundational. And especially, I brought it is chapter 11, but I brought it earlier because I wanted the students to really understand how, how we can gather data. Like, what does observational data look like? How do we know that there's an issue, right? How does that look comparatively to the province, right? And then being able to apply that. So a lot of the for their campaign assignment is related to an epidemiological outcomes, because I wanted them to go locally and look at what are the issues that we're seeing locally and it didn't have to be in Sarnia-Lambton, it could be Ontario wide, and that's based in epidemiology. I tried to get an epidemiologist to come and speak, and she wasn't able, but she did send me a whole bunch of slides on, some graphs on what we're seeing in Sarnia-Lambton comparatively to Ontario. And so that was really interesting, and to have conversations about them. And then when like I said, with the campaign, it is based in epidemiological data. And then for next semester, epidemiology needs to be part of their research proposal. And so yes, it's integral to the course.
Maybe I could just comment too, Cheryl.
Yeah, go ahead.
As Erin had mentioned, we had the opportunity, we needed to copyright or copy edit. So we are very familiar with the chapter. So I certainly recall some of the practice stories emerged very nicely, pulling out how public health nurses needed to understand epidemiology and apply it, and gathering the right kind of information, including epidemiological data, and how they applied it to scenarios. So those practice stories bring out how the public health nurses are using epidemiology in their day-to-day practice, as well as the chapter on epidemiology kind of steps you through that process as well, to give students their head around it. Because I know, having been part of nursing education for a number of years, it's just not a strong part of the curriculum. We know that. And so I think the bringing that forward in the chapter and in the nursing education, as Erin's talking about in assignments, are excellent ways to really build on that understanding and application as nurses.
Thank you, Ruth. And certainly lots of kudos and congratulations in the comments. People seeing different ways that they're going to use the book in Edmonton public health practice and different universities. Certainly, Danielle spoke about using the book in terms of sharing Indigenous history and opening space for healing and transformation. Do you see other ways that the book can be used? Anybody can take that one.
I'll say one thing about the textbook too is we are the third year students. We have clinical groups going into schools and doing that's their public health placement. So we're doing school health, but then they're able to teach it and then use the different. So I think going back to that built environment question, where we had students in their clinical do, a windshield survey, which is discussed in the textbook, and different assessment techniques on how to gather the data. So the students are able to bring the textbook with them to their clinical, and then the clinical instructors who are have backgrounds in public health are able to help them apply concepts or into practice. So.
Thank you. And Karen, did you want to add something?
Yeah, I alluded to this when I spoke, but it's real. I see it as being very useful in the practice setting for orientation, really knowledge development, knowledge translation amongst nurses. Depending on where you work, your work can be very siloed as a nurse. And it helps, it's a good reminder of the breadth of public health nursing. Right now, I'm working in vaccines, but I've also worked in schools, with community groups, with newcomer agencies. And even when I get in the vaccine space, I forget those pieces and how important it is to have that constant awareness. So it's also really helpful in practice settings. Thanks.
Yeah, excellent point. And Ruth, did you have something to add too?
Well, I was just going to really say what Karen said, and I'm hearing that already, that a lot of public health organizations, nursing leaders, practice leads are really talking about purchasing for their workplace, for exactly as Karen said, for orientation and professional development, because it really articulates, and I know that's the other part that we're hearing, is many people don't understand what public health nurses do, including in public health and broader community. And this will help them articulate what public health nurses do, both within public health, because there are 7 disciplines and we are the largest, but we need to be able to articulate what we do. And I think this is what we're hearing public health nurses feel, that this will help them do that. So it really is building on not only within academia and preparing our future workforce, but with a lot of, because we're seeing it hasn't been a strong part of the curriculum, unfortunately. And so nurses are coming into the workplace with not adequate preparation. So this is where the orientation will really be advanced through resources like this.
Excellent. And I really see the opportunity to advance these public health concepts across the curriculum, not just for public health nurses, but to the application, like we talked about, emergency response. We're just running to the end of time, but there's a question about Canadian schools of nursing, how many are using the text or plan to, and I doubt that we have that information, but I'm curious if there is a way to keep track of that and how we'll know. And just to build on that as a final question, we heard some discussion about a second edition, and is there anything that would be added to that to round out our discussion?
question. Well, that's why we raised it. Certainly, I think there's, as we mentioned, the competencies and standards that are new. We certainly want to have them more current. But I think, I mean, we wrote this almost a year and a half ago in terms of the actual writing. As we know, things are changing, and I think this is a piece that we're certainly going to strengthen. Certainly, the area building on planetary health, but I think almost in any area we're going to be hearing or wanting to hear from practitioners what are new areas that they're doing, how are they, the current research that's coming through. We are getting more and more public health nurses publishing, which is very encouraging. Mm-hmm. And I think that'll be something that we can certainly strengthen in the curriculum as we look at the evidence that's being produced. So that is exciting to hear.
Very exciting. And as we're talking about publishing, just a reminder, we are going to be having lots of discussions about the textbook and other public and community health things at our conference in Vancouver in the fall. And so just a big shout out and thank you to the amazing panel for your input and discussion, to Canadian Scholars for hosting. Be sure to check your email to see if you're one of the lucky people who got a free copy and take advantage of that discount code on the webinar. And in ending, I'd really like to acknowledge Erin and Ruth for your leadership, not just as editors, but for having the vision for this textbook and the determination and grit to see it full through to publication. I know it was a tight timeline and lots of hard work. So congrats on that, and so exciting. So thanks to everybody and to our participants for joining. Have a great day.
Thanks, everyone.